Hi guys, in this video, pag-uusapan natin ang isa sa mga delikado at nakamamatay na sakit. Ito ay yung stroke. So ano nga ba ang stroke? So ayon dito sa mayoclinic.org, so a stroke occurs when the blood supply to part of your brain is interrupted or reduced. So preventing a brain tissue from getting oxygen and nutrients, brain cells begin to die in minutes. A stroke is a medical emergency and prompt treatment is crucial. Early action can reduce brain damage and other complications. So the good news is that many fewer Americans die of stroke now than in the past. So effective treatments can also help prevent disability from stroke. So what are the symptoms ng stroke? So these are the symptoms. So if you or someone you're with may having a stroke, pay particular attention to the time the symptoms began. So some treatments options are most effective when given soon after a stroke begins. So these are the signs and symptoms. So trouble speaking and understanding of what others are saying. Next is paralysis or numbness of the face, arm, or leg. You may also suddenly develop a numbness, weakness, or paralysis in your face, arm, or leg. The next is problem seeing in one or both eyes. You may suddenly have blurred or blackened vision in one or both eyes. And then headache, a sudden severe headache which may be accompanied by vomiting, dizziness, or altered consciousness. You will also experience trouble walking. You may stumble or lose your balance. You may also have sudden dizziness or loss of coordination. So when to see a doctor? Seek immediate medical attention if you notice any signs or symptoms of a stroke, even if they seem to come and go or they disappear completely. Think fast and do the following. F for face. Ask the person to smile. Does one side of the face droop? A for arms. Ask the person to raise both arms. Does one arm drip downwards or is it one arm unable to rise? S for speech. Ask the person to repeat simple phrase. Is his or her speech slurred or strange? And lastly is T for time. If you observe any of these signs, call emergency medical help immediately. So call your local emergency number right away. Don't wait to see if symptoms stops. Every minute counts. The longer a stroke goes untreated, the greater the potential for brain damage and disability. So if you're with someone you suspect is having a stroke, watch the person carefully while waiting for emergency assistance. So what are the causes? There are two main causes of stroke: a blocked artery or ischemic stroke, and leaking or bursting of blood vessels or hemorrhagic stroke. Ischemic stroke. This is the most common type of stroke. It happens when the brain blood vessels become narrowed or blocked, causing severely reduced blood flows. Ischemia. Blocked or narrow blood vessels are caused by fatty deposits that build up in blood vessels or blood clots or other debris that travel through the bloodstream and lodge in the blood vessels in your brain. Some initial research shows that COVID-19 infection may be possible cause of ischemic stroke, but more study is needed. Let's talk about hemorrhagic stroke. Hemorrhagic stroke occurs when a blood vessels in your brain leaks or ruptures. Brain hemorrhage can result from many conditions that affect your blood vessels. Factors related to hemorrhagic stroke includes uncontrolled high blood pressure, overtreatment with blood thinners, bulge at weak spots in your blood vessels wall or aneurysm, trauma such as a car accident, protein deposits in blood vessel wall that lead to weakness in the vessel wall, or cerebral amyloid angiopathy. Ischemic stroke leading to hemorrhage. What are the risk factors? So many factors can increase your stroke risk. Potentially treatable stroke risk factor include lifestyle risk factor, being overweight or obese, physical inactivity, heavy or binge drinking, use of illegal drugs such as cocaine. The medical risk factor also includes high blood pressure, cigarette smoking or secondhand smoke pressure, cigarette smoking or second smoke exposure, high cholesterol, diabetes, obstructive sleep apnea, cardiovascular disease including heart failure, heart defects, heart infection, or abnormal heart rhythm such as atrial fibrillation. Personal or family history of stroke, heart attack, or transient ischemic attack. Also, COVID-19 infection. Who are the candidates for stroke? So, people aged 55 or older have a higher risk of stroke than do younger people. Also, race. African Americans have a higher risk of stroke than do people of other races. Sex. Men have higher risk of stroke than women. Women are usually older when they have stroke and they're more likely to die stroke than are men. Hormones. Use of birth control pills or hormone therapies that include estrogen increase risk. So what are the complications? A stroke can sometimes cause temporary or permanent disabilities depending on how long the brain lacks blood flow and which part was affected. Complication may include paralysis or loss of muscle movement, difficulty walking or swallowing, memory loss or thinking difficulties, emotional problems, pain, changes in behavior or self-care ability. So let's talk about how to prevent. So prevention, knowing your stroke risk factor, following your doctor's recommendation, and adopting a healthy lifestyle are the best steps you can take to prevent stroke. So if you had stroke or transient ischemic attack, these measures might help prevent another stroke. The follow-up care you receive in the hospital and afterwards also may play a role. So many stroke prevention strategies are the same as strategies to prevent heart disease in the general healthy lifestyle recommendation include controlling high blood pressure or hypertension, lowering the amount of cholesterol and saturated fat in your diet, quitting tobacco use, managing diabetes, maintaining a healthy weight, eating a diet rich in fruits and vegetables, exercising regularly, drinking alcohol in moderation if at all, treating obstructive sleep apnea, avoiding illegal drugs. Preventive medications. So if you have a ischemic stroke or TIA, your doctor may recommend medication to help reduce your risk of having another stroke. These include antiplatelet drugs. Platelets are cells in your blood that form clots. Antiplatelets drugs make these cells less sticky and less likely to clot. Next is anticoagulants. These drugs reduce blood clotting. Heparin is fast acting and may be used short term in the hospital. So let's talk about the food for stroke patient to help them recover. So these are the foods that can help recover a patient suffering from stroke. So Number one is flax seeds. So flax seeds are a great source of alpha linolenic acid or ALA, which is a plant-based essential omega-3 fatty acid that must be obtained through the diet. Your body cannot produce ALA on its own. It must be eaten. Number two, salmon. Number three, blueberries. Number four, pomegranate for antioxidants. 5, tomatoes for lycopene. Number 6, nuts and seed for vitamin E. Number 7, avocados for oleic acid. Number 8, beans for magnesium. Number 9, red wine for polyphenol.